speak about the basics. I just wanted to speak about the basics, and that is, I just wanted to tell you what is fertility first. Coming to the fertility is the capacity to establish an clinical pregnancy. So, when couple is trying for pregnancy, what happens actually? You know, in a female, there is a uterus, two fallopian tubes, and two ovaries. So, a woman who is having regular cycles of 28 to 30 days, generally in the second half, that is anywhere between 12th to 16th day, one egg grows and it is released into the abdomen, and it is taken up by the fallopian tube. And when the couple has intercourse, the sperm travels up through the fallopian tube into the fallopian tube and meets the egg. And if fertilization happens, the pregnancy comes and sticks in the uterus. This is the normal way of pregnancy. So now coming to the what should you do when you're planning the conception? That is preconceptional planning. So first thing, you have to take prenatal vitamins such as folic acid and multivitamins. Then, if you have a habit of smoking and alcohol, that should be completely stopped, as it has an effect on the sperm and the egg and the pregnancy and the chances of conception. And the couple should maintain a healthy lifestyle. When I say a healthy lifestyle, it includes exercise as well as maintaining a good diet and proper sleep and stress free life. And if the man or the woman is using certain medications from previously, or having any medical conditions, you have to review with your physician and just check with them to see whether these medications are safer in pregnancy or they have to be changed. And if you're suffering from any medical disorders, such as for example, such as diabetes or hypertension, those have to be under control, as they have an effect on the pregnancy. Even the thyroid, if you have a thyroid problem like hyperthyroidism or hypothyroidism, you have to meet your physician and correct the hormones if they're not under control. This is most important. And all the blood test has to be done, like hemoglobin, sugars, any you have to test for your I have a question in now. What are the signs and symptoms of infertility? There are no signs and symptoms as such. It is not a disease. First and foremost, what is infertility? Infertility is when couple is trying to conceive uh, and not able to conceive in spite of having unprotected intercourse for 12 months is the definition of infertility. And it also depends on the age and when they're having intercourse, and also any diseases are underlying. So this is the answer to the question. And now, coming to the what I was talking about, the preconceptional part, what care should be taken. And now, coming to the viral infections, the rubella test has to be done. And if the antibodies are not positive, if the antibodies are not present, then you have to take the rubella vaccine. And now, as we are in midst of COVID pandemic, please, everybody, whenever at your turn, please take the COVID vaccine. You have to take your COVID vaccine, and it has shown no effect, as it's not a live virus. It has, the COVID vaccine has not shown any effect on the fertility aspect or increasing the infertility in patients. So now coming to when you're planning pregnancy and you have taken first dose of vaccine, and in between the time of second dose you have conceived, there is no problem. You have to take the second dose as scheduled. So this is very important that you take the COVID vaccine and stay safe. So now coming to the uh, first and foremost, what are the causes of infertility? As I've told you, when we call infertility, that is when a couple is trying for 12 months to conceive, and with unprotected intercourse and not able to succeed. So now coming to the causes. What are the causes of infertility? It mainly depends on the first and foremost cause in the female is depends on the age. So age plays a vital role in the fertility of the person. And I just want to tell you the basics. When at birth a woman is born with certain number of reserve, around 1 to 2 million of eggs. As our age increases, the eggs number tend to come down, and the woman's peak efficiency or the fertility efficiency is maximum in 20s. And as the age increases and it goes beyond 30s, the number of eggs as well as the quality of the eggs tends to come down. So, women above 30 can have certain difficulties in conceiving. So, what we say is, as I previously told, if the woman is less than 35 years of age, and they can wait till 1 year before consulting a doctor. But if the woman is more than 35 years of age, and they have to visit a fertility specialist after trying for 6 months only, because the age plays a very important role. So now these days, the uh, delayed childbearing or planning for the pregnancy in a later age has increased. Why? Because now the women are more focused. They're highly educated now, and they're more focused on career, and they want to delay their childbearing till they succeed in their career. So when you're planning in such way, you have, depending upon your age, as I said, if you're less than 35, please wait for 1 year, and if you're more than 35, visit the fertility doctor within 6 months. So as when the age increases, we have seen increase in the number of miscarriages also. So no, and exception to this, whatever I have told, like age factor, there are other factors where you have to meet the fertility specialist immediately. When, as I said, you're more than 35, I've been trying for 6 months, and you're more than 40 years, you have to visit the doctor. And when you have irregular cycles or cycles, absent cycles or periods, and you have recurrent pregnancy losses, more than two of pregnancy losses, and you need to visit the fertility specialist. And you have undergone a cancer treatment or diagnosed with cancer, you have to visit the fertility specialist. Now coming to the what all causes we see of fertility in women. So, coming as I told previously, you have a uterus, two ovaries, and two fallopian tubes. Now, the first and foremost is the ovarian function problem. That is, as I previously told, that is, you might have irregular cycles, or there are no cycles at all, or you have cycles but there is no ovulation on time. All these things leads to, I mean, all these things are effect of hormonal imbalance in the body, and those need to be tested and corrected. Next comes the fallopian tubes. As I mentioned earlier, the fertilization which happens in the fallopian tubes. So the fallopian tubes have to be open, and the blockage is seen in when there are previous history of infections or previous pelvic surgeries which might cause additions, and and the previous history of ectopic pregnancy. The ectopic pregnancy means having pregnancy in the tube other than the uterus. And in cases of endometriosis also, we have seen partial blockage. So these are the reasons for the tubal blockage. And now coming to the uterus part, uterus is where the pregnancy sticks or the implants. So we have to test in the uterus, are we missing anything, such as any growth from the endometrium, in the endometrium, such as polyps or any uterine musculature benign growth such as fibroids. The fibroids are in multiple locations, such as internal inside the uterus or outside the uterus. All these have to be tested. And how is the endometrium layer, whether it is which is good, which has to be 8 minimum thickness, where the pregnancy comes in implants. So now other cause we see is the primary ovarian insufficiency, where ovarian insufficiency is generally seen above 40, but in these women it is seen less than 40 years of age. This can be due to genetic conditions such as Turner's or Fragile X, or they have undergone radiotherapy or chemotherapy. And now coming to the male partner, when they should be seeing the fertility specialist is when they have a low sperm count, they have been diagnosed with cancer, or previously they had treatment for the cancer treatment, and they have sexual problems. They need to visit the fertility specialist. Now I just want to mention the cumulative fertility rates among all the couples who are trying to conceive. I just want to give an idea. Who are trying for 12 months without unprotected intercourse, they have a chance of 85%, and who are trying for 6 months, they have a chance of 60%. And this is just information which was in all these couples, after 12 months of unprotected intercourse, we see around 12 to 15% of couples unable to conceive, and we have to rule out all the causes which I have told you previously. So now coming to the uh, timing. So in a cycle, as I have said, a cycle of 28 days. First 2 weeks it happens to ov- for egg to develop, and after that it's the luteal phase. So the patient or the couple should be aware of this fertile period, and they should have a timed intercourse or regular intercourse. So having regular intercourse is the first and primost important to conceive. So there are certain indirect methods to check the ovulation, such as ovulation kits. It's a simple test where it's similar to a pregnancy test, where you just do with the woman's urine, and if two lines are there, it means that she is about to ovulate. So they can use this indirect test. And now, when the couple after 12 months, or as I said, if they're more age, more than 35, they have come to the clinic for the evaluation, what all is done? So first and foremost, we take the detailed history of the couple, which involves their medical problems, or their any other issues are they facing, and any history of surgeries, infection. Detailed history has to be taken for the couples. And the next comes the investigations. In the investigations, first and foremost done is the ultrasound of the ultrasound is done, where we assess the ovaries and the uterus, and certain blood investigations for the hormonal evaluation is done. Uh, in the ultrasound, we can know on the second day to fifth day of the cycle, in the women we can know at what ovarian reserve we are seeing, and how many number of eggs are seen. We correlate with the hormones. And also we do the fallopian tube testing, which is done by HSG or an saline sonography. So, and next comes the um, male partner, where we do a simple test called a semen analysis, and we assess the sperm count, the motility, and the morphology. So any change in this motility, morphology, or the count, we would advise further investigation and to meet the andrologist in order to enhance the chances of conception. So so there are few couples where we everything is fine, the semen parameters is fine, the tubes are absolutely fine, they're ovulating and everything is fine, though they've come under unexplained infertility where everything is fine and still they are not successful. So now coming to the treatment part, as I have told previously about all, we have to rule out all the causes, like if there is ovarian insufficiency, or the hormonal imbalance that has to be corrected, and the tubes there is a block, or we have finding a myoma or endometriosis is there. Endometriosis is the presence of endometrium outside the uterus, and it can be seen in the ovaries such as chocolate cyst or endometrioma. It can be seen in the tubes, deposited on tubes in the pelvis with additions. So that has to be corrected surgically. Surgical treatments are done when there is a fallopian tube block, there is a myoma, or uh, any septum or uterine anomalies is there. All these things can be corrected with um, surgery, laparoscopy, and any sperm factor is seen, the treatment is given, and we advise to see the andrologist. So now coming to after correcting all this, we as normally we need only one egg. So the first and foremost treatment comes as ovulation induction, where simple medication is given to the woman, and instead of one egg, if two or three eggs are grown, we have better chance of conception. And we go step by step, first with ovulation induction depending upon the age and how long they have been married and how long they have been trying. And the next comes the intrauterine insemination, where they're unable to have intercourse or the sperm parameters are little on the lower side, the IUI can be tried. And the last and advanced and very good technique is the in vitro fertilization and intracytoplasmic injection. It depends on the couple, and as I said, IVF is not done for everybody. They have certain indications, such as the age factor, as it will if they're more than 40 or more than 35, married for 10 years, or and they've been trying with multiple treatments, or they have a sperm factor which is low sperm count, or they have been having multiple miscarriages where they are unable to conceive. They are able to conceive but unable to have a good pregnancy. All these or they are diagnosed with cancer and they have to preserve their fertility. All these patients would require uh, IVF treatments, and the I hope this is a and everybody would whoever is planning to conceive would follow all these things, and they have understood clearly that when to meet a fertility doctor when you're planning for conception. I have few questions here. Okay. I have a question. Can you get pregnant and become infertile, doctor? Yeah, as I previously mentioned, age plays a very important role in female fertility. So, once what we have seen in our practice is secondary subfertility or secondary infertility is more compared to the primary infertility. As I told, the age of the woman matters, and as if they're above 35, the number of eggs and number of and the quality of the eggs tends to come down, so they might it might be little difficult for them to conceive. um, Another question is infertility a woman's problem? No. Infertility is both man and women's problem. They can be as I previously mentioned earlier in this talk, that there are certain number of lot of causes where we have to test both the couple if they're not able to conceive. Okay, what impact does infertility have on psychological well-being? Yeah, this is a good question. uh, it plays it has this huge psychological impact on the couple. They get stressed out that they have been trying so long, it's not happening. But they should not lose hope or go into a different mode. They need to properly assess themselves, how is their lifestyle, what diet they're eating, and they need to visit a fertility specialist and just get it checked that everything is all right and nothing to worry, they will conceive eventually. Okay, what information should I get from my infertility doctor on my first visit? Okay, so when you go for the first time to a fertility specialist, they will take a detailed history. like how long I've been married, how are your cycles, how how do you have any coital issues, or and they will check an basic ultrasound for the female partner and the semen analysis for the male partner, and required hormones such as thyroid, prolactin, AMH, depending upon your age. So this is the basic information you need to know. You need to know when you go to the first visit of your fertility specialist. Can infertility be cured with lifestyle changes? Yes, the answer would be yes. So, depending upon the cause of infertility, if everything is fine and the only problem is the lifestyle, then yes, definitely it enhances the chances and it also helps in conceiving. And a few more questions are there. So, one question is, as I mentioned for the fallopian tubes, HSG, does it clear the blocks of the tube? So that's a good question. And what I would say is HSG is to see the patency of the tubes. So they're minute mucus plugs, minute mucus plugs which be there. If we use little pressure, they can be cleared from HSG. And what additional tests can be done if the woman is more than 40 years, so who is planning to conceive? So apart from the test which I have told, no additional tests are done, and we need to assess the number of eggs, especially when you're above 40, and the quality of the eggs. So that's it. And other question is, what's the specific advice you give for patient who is diagnosed with PCO? So now coming to the PCO, PCO is a very common, or we are hearing PCO a lot these days, probably because of the altered lifestyle, unhealthy food habits, and so in PCO patients, again, it depends. The as it's you, whoever is planning to conceive has to follow a healthy lifestyle, maintain an ideal BMI, and if any further medical conditions are there, you have to correct them. And in PCO, there is nothing that you can't conceive, but you need to visit a doctor and take all the medication and what all has to be done, and you can conceive. So I think this is the last question. Is IVF a must in? Is IVF helpful for recurrent pregnancy loss? So the recurrent pregnancy loss is something which we have to identify the cause, and IVF to certain extent can be helpful, as we do a genetic testing for the embryo and replace back into the uterus. So but not always we can say that IVF is the only choice in but it is definitely helpful in a majority of the cases. Hope the message when to visit the fertility specialist is clear, and thank you for patient listening. Thank you.